Hi folks, welcome back to part 2 of our second episode in Truth in Medicine on a 100-year treatment of diabetes and how it led to the obesity epidemic and chronic disease in our country. No one more important than Ancel Keys contributed to this damage. Let's look at what happened since 1950. He single-handedly created the saturated fat, cholesterol, heart disease theory. It's a classic example of unreliable, bad research, personal bias, selective misuse of statistics. One man, a persuasive man, controlling and promoting a bad narrative for decades, picked up and believed by the American Heart Association and our medical community. After 30 years, Ancel Keys actually came out and he said, 1987, I've come to think that cholesterol is not as important as we used to think it was. It was a little too late. In 1989, when other scientists actually reevaluated the original 7-country flawed study, they showed that sweets and sugars, not saturated fat, actually correlated with heart disease. So in a way, Ancel Keys was right. Diet was the cause of obesity and heart disease. It just wasn't saturated fat, but sugar, processed carbohydrates. If I was going to write an op-ed today on the single greatest contribution to the obesity epidemic and chronic disease, I would blame Ancel Keys and his influence on the American Heart Association, American Diabetes Association, government agencies to promote the low-fat, thus high-carb, high-insulin diet. But it wasn't that alone. Just like why planes crashed, there are multiple errors. And if you look at other contributing factors, it would have to be high fructose corn syrup that was promoted around the same time. The food industry jumped on the low-fat bandwagon. What they replaced low-fat with was more carbs, more sugar, more processed foods, and artificial sweeteners, which are almost as bad as sugar and high fructose corn syrup. I would look at the biased, corrupt food pyramid. The food pyramid was promoted by government agencies, the U.S. Department of Agriculture, and every federal institution, every institution that receives federal money, like our school cafeterias, our hospitals, they all had to adhere by this flawed food pyramid. So some of our most vulnerable people, our children and our patients, were getting this misinformation to eat 6 to 11 helpings of sugars, grains, cereals, carbohydrates. And there's a latent period. It takes decades for this to cause chronic diseases like heart disease and even cancer. And that was promoted by our government institutions. Sedentary lifestyle, high tech, phones, video games, more screen time, and misinformation was promoted. They blamed obese and fat people on having no willpower. They told them they just needed to exercise more and eat less. But in reality, like we talked about, it's the hormonal basis of obesity. It's the insulin, stupid. Other culprits contributed too. Even our most revered physicians, Elliot Jocelyn, they wrote 14 editions of a book that I used in medical school. 14 editions into the 21st century. They had 3 paragraphs on the fattening effect of insulin. He too believed that diabetes, heart disease, was from fat and not from carbohydrates. And all they did was increase the insulin to cover the carbohydrates in the diet. Our government, McGovern, had a report in 1977, which really influenced the beginning of the USDA dietary guidelines, which are produced every 5 years up until present time. It was written by a staffer, no science or nutritional background. They recommended no more than 10% of your energy coming from saturated fats. They recommended up to 50% carbohydrate intake, increased insulin. Decrease cholesterol. And really, eating cholesterol, increasing your cholesterol, has very little, if any, effect on your blood cholesterol. In 1988, C. Everett Koop, the Surgeon General, spewed this misinformation. High-fat foods are causing coronary vascular disease and other deadly ailments. The depth of science, he said, is more impressive than cigarettes. He was expressing a consensus. This was not science. This was medical expert consensus with no scientific basis. Even the National Institute of Health, the American Cancer Association, said there was no doubt that the low-fat diet afforded significant protection against coronary artery disease for anyone over 2, and it prevented cancer. Then in 2001, finally, an independent research organization, the Cochrane Collaborative, which was really initiated because they doubted a lot of the biased publications by organizations like the American Heart Association, like the American Diabetes Association, looked at the literature and they showed saturated fats have no effect on mortality. These things began to be questioned around 2000. They started to question the saturated fat theory by journalists like Gary Taubes, not revered medical organizations or governments. Between 2008 and 2012, a lot of money was put into studies to show that if we control blood sugar, we could decrease heart disease, mortality, and live longer. And you know what happened? They were all miserable failures. And you know why? Because they tried to control blood sugar by drugs and not diet. And they didn't realize the negative effect of insulin. They were trying to tightly control blood sugar by insulin, and they couldn't figure it out. It actually increased mortality, and mostly because the negative effects of hyperinsulinemia. They never studied diet. And to this day, it's never been studied. A true diet study has never been done to look at how it affects cardiovascular disease and mortality. 20 papers were performed and reported on that showed no basis to limit fat intake. They disproved Keys' theory in the second decade of the 21st century. It showed there was no increased heart attacks, cardiovascular mortality. It actually lowered total mortality and strokes. Crazy advice for 70 years that violated the do no harm Hippocratic Oath. Even the most recent dietary guidelines in 2020 still stated there was a strong relationship of saturated fat to heart disease, which is false. We're looking for change in 2025. So in reality, saturated fat was a very unscientific consensus. There was no science behind it. There was never a trial that established a causal link of increased saturated fat in your diet to heart disease. But in the 21st century, in the last 15 years, we now have good studies. There's over 20 good studies right now that show saturated fat has no effect. Yes, saturated fat has no effect on cardiovascular disease, cardiovascular or overall mortality, heart attacks or strokes. And there was actually a pure study, 2017, that showed it actually lowered mortality and lowered your risk of having a stroke. This is sort of interesting. So Virta Health was a program started by non-mainstream physicians and a triathlete CEO. You know what they did? They looked back again at the animal diet of 200 years ago, and they started a telemedicine startup. And they found out that if you followed this low-carb, high-fat diet, which we knew 200 years ago prevented diabetes or kept diabetic patients alive, that it could actually reverse type 2 diabetes with a nutrition first, not a drug first approach. And you know what they found? If you followed this approach with an app on your phone and coaching for 5 years, 60% of diabetes was reversed, 94% got off or reversed their insulin requirement. It improved their cardiovascular health, hypertension, liver enzymes, BMI, and inflammatory markers. So it's absolutely amazing. And it's very successful. They had a $175 million profit In 2024, they have a market cap of over $1 billion. And you know who their customers are? Large employees, health plans, government entities, and telehealth organizations. And you know why? Just look at the numbers. They could save $13,000 per patient over a 2-year period. Look at the opposite. Look what it costs for GLP-1 drugs, $1,000 a month, $12,000 or $13,000 a year for these patients. So it's not sustainable with Medicare, and it's why a lot of the Medicare plans do not cover these expensive drugs. Here's a non-drug, a diet approach, which normalizes blood sugar, decreases diabetes, improves your health, none of which insulin does, increasing insulin. So I looked around. It's not popular yet in our area, but it is popular around the country, and it's an interesting phenomenon. If you look back at the 1800s, what's common about this approach? Back then it was called the animal diet. It's really what humans ate for 100,000 years. Low carbs, low insulin, a ketogenic diet. How about in the 70s? That's the Atkins diet. It's still sort of shunned when you hear the Atkins diet, but he was right. They picked the wrong horse. That too was a low carb, low insulin, ketogenic diet. And look at Virta Health. These are all non-mainstream approaches. Atkins was a non-mainstream physician. Virta Health, not mainstream physicians. They promote a low-carb, low-insulin, ketogenic diet. It's absolutely amazing. But if you look at Virta Health, I always look at that like students and athletes. You can have a great student and a great athlete, but they need coaching. They need education to get better. So a lot of physicians don't have the time today. Like we said, they tell patients, like the video showed today, lose weight, eat less, exercise more. But this approach works, but it takes time. A lot of physicians don't have the time to do it, but this approach does. It's modern technology, it's high tech, it's app, it talks to the patient, it coaches them, it educates them, it encourages them, and it works. It's one of the few diets that can actually reverse type 2 diabetes. Ketogenic diets can control your blood sugar, insulin spikes, reduce the risk of diabetes, heart disease, and cancer, and prolong your life. Nearly half of the US population has diabetes or prediabetes or insulin resistance. That's 150 million or more people. Are you among them? It has to do with insulin. Stay with me, and I'm going to give you some tips on how to improve your life and live longer. Welcome back to the conclusion of our Truth in Medicine 2-part series on the history of diabetes and how it contributed to the obesity epidemic and chronic diseases. Right now, there are over 150 million people with diabetes, prediabetes, or insulin resistance in this country. Something went wrong. This wasn't evolution. If you look at the environmental factors that have occurred over the past 100 years, increasing sugar consumption by 1,000%, the insertion of processed foods into our food. Somewhere in our lifetime, we will eat 75 metric tons of food. It's estimated now that 2/3 of that, or somewhere around 47 metric tons of food, are processed food, high carbs, high sugar, chemicals, and we are what we eat. So no wonder we have a decreased lifespan and we're so sick in this country. But sadly, we weren't helped by some of our venerable medical organizations. So let's look at some major takeaways from the past 100 years of diabetic treatment in this country. We actually knew the answer 150 years ago, but we ignored it. Smart people at that time knew that carbohydrates made you fat and sick and died sooner. They didn't know it was from insulin. Heart disease in diabetic patients is an accelerated model for all heart disease patients. It's not something that diabetics get that the rest of us don't. So even if you don't have diabetes, you can look at some of the root causes in heart disease to be the same. Singular people have shaped misinformation on diet and treatment for decades, 50, 60, 70 years. We talked about Ancel Keys. Even a diabetologist, Jocelyn, who's famous, wrote 14 textbooks, didn't get it all right all the time. Other government officials, McGovern, our Surgeon General, C. Everett Koop, and medical organizations. We violated the Hippocratic Oath of doing no harm. And you know what? We never apologize as a medical organization, as a medical society, as a medical group. We never apologize or take responsibility for decades of misinformation that had a major contributing factor of the obesity epidemic and chronic disease. No matter what your political inclinations are about RFK Jr. or Dr. McCarry, these are not mainstream people, but you know what? They're finally getting the government to look at some of the root causes and look at some of the corruption in some of the government organizations like the FDA that are influenced by the pharmaceutical company. It was crazy to recommend 50 to 60% carbohydrates for not only all people, but for diabetic patients. This was crazy. It increased insulin, and insulin is very good if it works within the expected brackets, but hyperinsulinemia is terrible. We always have underestimated the harmful role in chronic diseases. Our medical institutions, our government agencies, the food industry, the Department of Agriculture, the Surgeon General, made everyone fat and chronically ill from hormonal imbalances. That is, excessive insulin, just like we started the show with. Obviously, Big Pharma is the winner. They can now treat metabolic syndrome, heart failure, with hypertension meds, statins, and other drugs. Now we have another win for Big Pharma to treat a problem we created, massive obesity, with another blockbuster hormonal agonist, GLP-1 drugs, which will be followed by other drugs to treat the complications of GLP-1s, like muscle loss, poor nutrition, constipation, the development of oral agents. Hyperinsulinemia is bad. Insulin makes us fat. It's the most lipogenic molecule in us. Insulin makes us hypertensive. It retains sodium. Insulin is atherogenic. It causes heart disease, strokes, vascular disease. It's an anabolic hormone. It thickens your vessel walls around the heart and all over your body. It weaponizes LDL, the bad cholesterol. It makes LDL more atherogenic. It accelerates the oxidation of LDL, of the cholesterol in the LDL. It accelerates the oxidation of ApoB, a protein in the LDL. It makes LDL harder to clear from your blood, therefore increasing the LDL level in your blood. Insulin is carcinogenic. Hyperinsulinemia stimulates cell growth, proliferation. It provides carbohydrate food for tumors. It modulates gene expression. It increases your risk of pancreatic, breast, prostate, colorectal cancers, and other causes. So if you think of it, hyperinsulinemia can increase the two leading causes of death in this country, heart disease and cancer. And not to mention contributing to blindness, kidney failure, and peripheral neuropathy. Know your insulin level. Ask to get a fasting insulin level. If you are overweight and you can't lose weight, it's your insulin level. Lower your insulin by significantly limiting your sugar, starch, refined grains. Spoiler alert, exercise and diet will not help you lose weight unless you know your insulin and lower your insulin level. Know your fasting glucose also. Question normal lab values. A lot of times the modern lab values are not always normal for you. They might be normal for a population. Let's check for insulin resistance. You can check for insulin resistance even if you don't have an insulin level. Just look at your triglyceride to HDL ratio, and that's almost in every annual test. That ratio, if it's over 3, indicates insulin resistance. It should be 1-to-1. If it's over 2, you're on your way. So that's a backdoor way to see if you are insulin resistant. Check your triglyceride, look at your HDL, look at the ratio, and it should be 1-to-1. If it's over 3, you're insulin resistant. There's something called the homeostatic model assessment for insulin resistance, HOMA-IR. It's a math test. If you get your fasting insulin, multiply it by your fasting glucose, divide it by 405, you'll get a ratio. It should be under 2. If it's over 2, it's an indicator that you are insulin resistant. Here's an example of a normal value that perhaps isn't normal. They have a fasting insulin level can be normal up to 20 or 25. But let's say yours is 10 and you go, boy, I'm not insulin resistant. Well, multiply that by, let's say, a fasting glucose of 100 or 120, you're going to get 1200, divide it by our ratio, and that is 3 or more, and you're insulin resistant. But you have a normal insulin. So it's a little bit of a math challenge to figure that out. Let's do a quick primer on lipid numbers. Total cholesterol, basically ignore it mostly, unless you have a familial problem. LDL, not all LDL is bad. If you have no other risk factors and you have a slightly increased LDL and a statin is recommended, ask for a small density LDL or an ApoB test. Those are more indicative and more related to cardiovascular disease. Know your triglyceride and HDL. They are equally or more important than your LDL. Know your ratio. Keep it under 2. Higher can indicate insulin resistant. You know what lowers your triglycerides? Fish oil, omega-3. You know what increases it? Sugar, carbs, and insulin. How about HDLs? A higher HDL is good. You know what increases your HDL? Exercise, vitamin B, CoQ10, weight loss. And avoid hydrogenated vegetable oils. The same thing the ADA and the AHA have recommended for years. This information is brought to you by Dr. Meade and Truth in Medicine to help you live longer and live better. Stay with me on my next episode. I'm going to go into a little more depth on the GLP-1 drugs, the good and the bad. Thanks for watching.